Hello, I'm Dr. Katia Batista, a specialist psychiatrist. Today, I'm going to talk about an important topic, anxiety. And to start, I would like to share a real and powerful story. Prince Harry. He has spoken openly about his struggles with anxiety and panic attacks. After the tragic death of his mother, Princess Diana, he suffered for many years in silence. Only later, through therapy and emotional support, he was able to manage his anxiety and reclaim his mental health. His story reminds us that mental health issues can affect anyone, even members of the royal family. Another inspiring example is Emma Stone, the Academy Award winning actress. Emma has shared that she experienced severe anxiety and panic attacks since she was a child. At times, her anxiety became so overwhelming that she could barely leave her home. Thanks to therapy and her passion for acting, she found ways to express her emotions and manage her anxiety. Her story teaches us that what we see on the outside often hides deep inner struggles. Now, let's talk about what anxiety is. It's a normal and natural response to stress or danger. It is part of our survival instinct. It helps us stay alert and ready to act. But when anxiety becomes excessive, persistent, and disrupts daily life, it turns into a mental health disorder. Common symptoms of anxiety include psychological symptoms such as excessive worry, fear, racing thoughts, difficulty concentrating, physical symptoms, rapid heartbeat, sweating, trembling, shortness of breath, stomach discomfort. There are several types of anxiety disorder, each with their own specific features. Let me mention some of them. Generalized anxiety disorder is a persistent and excessive worry about aspects of life, even when there is little or no reason to worry. People with this condition often feel restless, fatigued, and have trouble concentrating. Panic disorder. In panic disorder, recurring unexpected panic attacks, intense episodes of fear that trigger physical symptoms like chest pain, shortness of breath, dizziness, and a fear of losing control or dying are common. Agoraphobia is a fear of being in situations where escape might be difficult, such as open spaces, crowded spaces, or being outside alone. Many people with agoraphobia avoid leaving their homes. Social anxiety disorder is intense fear of being judged, embarrassed, or humiliated in social situations. It can interfere with daily activities like speaking in public, meeting new people, or even eating in front of others. In a specific phobia, there is an intense fear of a particular object or situation, such as heights, animals, flying, or receiving injections. The fear is usually out of proportion to the actual danger. Separation anxiety disorder, commonly seen in children. There is an excessive fear or anxiety about being separated from attachment figures like parents or caregivers. It can cause nightmare, physical symptoms, and refusal to go to school or other places. Selective mutism is a complex childhood anxiety disorder where a child is unable to speak in certain situations, social situations commonly, despite speaking comfortably in others, like at home, is often linked to extreme social anxiety. The good news is that anxiety is highly treated. The main treatments are psychotherapy and medication. In the case of the psychotherapy, the most used is cognitive behavioral therapy, helps patients identify and change negative thoughts patterns. Interpersonal therapy focuses on improving relationships and emotional expression. Psychodynamic therapy explores unconscious conflicts that contribute to anxiety. In the other in the other part, we have medications. Psychiatry medication such as antidepressants and benzodiazepine may be prescribed depending on the severity of the symptoms. If you are struggling with anxiety, here are a few tips. Practice deep breathing and relaxation techniques. Stay physical active, even a short walk helps. Maintain a healthy routine. Regular sleep, healthy eating, and limiting caffeine. Don't hesitate to seek professional help when needed. Remember, you are not alone. Anxiety can be overwhelming, but with help and the right tools, you can regain control of your life. Taking care of your mental health is an act of courage and strength. Thank you for being here with me today. If you found this video helpful, don't forget to like, share, and subscribe to this channel. See you next time.